Take a deep breath. For over 300 million people worldwide, that simple act can be a real struggle. I'm Dr. Anim, and today on Health Made Simple, we're talking about asthma. What causes it, why it's becoming more common, and the exciting new treatments that are changing lives. Let's break it down. Asthma is a lung condition where your airways, the tubes that carry air to your lungs, become inflamed and narrow. Think of it like a garden hose that gets squeezed and clogged at the same time. The main symptoms are wheezing, shortness of breath, coughing, especially at night, and chest tightness. But here's the good news. Unlike some lung diseases where damage is permanent, asthma is reversible. With the right treatment, you can breathe normally. So what's happening in your lungs during an asthma attack? 3 things. First, the muscles around your airways squeeze tight. Second, the airway walls become swollen and inflamed. Third, your airways produce thick, sticky mucus that clogs everything up. The result? Air gets trapped. You can breathe in, but you struggle to breathe out. That's what causes that classic wheezing sound. So, what causes asthma in the first place? It's a combination of your genes and your environment. If one of your parents has asthma, you're 3 to 6 times more likely to develop it. But genes aren't the whole story. This is where the hygiene hypothesis comes in. The theory is that our modern super clean environments are actually part of the problem. When babies are exposed to everyday germs early in life, their immune systems learn to tell the difference between what's dangerous and what's harmless. But in overly clean environments, the immune system doesn't get that training. Instead, it can overreact to harmless things like pollen or dust, leading to allergies and asthma. The evidence is pretty strong. Kids who grow up on farms or go to daycare have lower rates of asthma. This ties directly into allergies. About 80% of people with asthma also have allergies. There's even a progression called the allergic march, which can start with eczema in babies, then food allergies, then hay fever, and finally, asthma. Because of this strong link, we classify asthma into 2 main types: allergic asthma, usually starting in childhood, and non-allergic asthma, which can start at any age. So how do doctors diagnose it? The main test is called spirometry, where you blow hard into a machine. It measures how much air you can push out and how fast. In asthma, these numbers are lower than normal. The key is that after you use a rescue inhaler, your numbers should improve by at least 12%. That shows the airway narrowing is reversible, which confirms asthma. Now, for the exciting part, treatments. Traditional treatment uses a step-by-step approach with inhalers, which works great for most people. But for the 5 to 10% of people with severe asthma, we now have incredible new drugs called biologics. These are targeted antibody drugs that block specific parts of the inflammation pathway. For example, some drugs block the IgE antibodies that drive allergic reactions. Others block signals that activate certain inflammatory cells. The newest one even blocks a master signal that sits at the top of the inflammatory cascade. These drugs are game changers, allowing people who were constantly in the hospital to live normal lives. They are expensive, but they offer hope for the most severe cases. So, what can you do right now if you have asthma? First, work with your doctor to identify and avoid your triggers. Second, take your daily controller medication even when you feel fine. Asthma is a chronic condition that needs daily management. Third, make sure you have an asthma action plan. And please ask your doctor or pharmacist to check your inhaler technique. Up to 70% of people use them wrong. Finally, don't settle for poor control. If you're using your rescue inhaler more than twice a week, it's time to talk to your doctor about better options. The bottom line is that asthma is complicated, but it's highly treatable. With modern medicine, the vast majority of people with asthma can live completely normal, active lives. If you found this helpful, please like, subscribe, and share. Let me know in the comments if you have asthma and what your experience has been. I'm Dr. Anim, and this has been Health Made Simple. Breathe easy, stay informed, and I'll see you in the next video.